Having finished the axial skeleton, here we are talking about the appendicular skeleton. So remember, appendicular, like appendix, it's something that hangs off of. So it's going to consist of the two arms and the two legs, your four limbs, plus the pectoral girdle. That's what holds your arms to the axial skeleton. Do you remember? We talked about this before. What two bones make up the pectoral girdle? That would be the clavicle and the scapula. And then the pelvic girdle is os coxa, the hip bone. So the appendicular skeleton is 126 bones. Remember, the axial was 80. That makes 206 regular named bones in the human body. Appendicular skeleton includes the upper extremities, the lower extremities. The upper extremities attached to the axial skeleton at the pectoral girdle, the clavicle and the scapula, and the lower extremities attached to the axial skeleton at the pelvic girdle, os coxa. Os, bone, coxa, hip. Os coxa, literally the hip bone. Appendicular skeleton functions to facilitate movement. So, if you didn't have arms and legs, there's not much you could do. I mean, you could, play second base. I mean, you would be second base. You couldn't actually play it. You have to have arms and legs in order to run and throw and do things like that. So, without the appendicular skeleton, we wouldn't be able to engage the world. So the pectoral or shoulder girdle attaches the bones of the upper limbs to the axial skeleton, the scapula, and the clavicle. Clavicle articulates with the sternum. Remember, articulate means forms a joint with. This is called the sternoclavicular joint. Now, you don't have to know that for your first exam, but you will have to know it for the second. Once again, I preview things before you have to know them. And look at how easy that name is, sternoclavicular. It's where the sternum and the clavicle come together. Clavicle also articulates, forms a joint with the scapula. That's the acromioclavicular joint. And remember, what's the name for your shoulder region? That's your acromial region. We'll see that that's a process on the scapula. Scapula is held in place by muscle only. It doesn't really make any firm joints with anything. It's just a bunch of muscles that hold the scapula where it is. And the upper limb attaches to the pectoral girdle at the shoulder. That's the glenohumeral joint. Your upper arm is called your humerus, and the place where it attaches is called the glenoid cavity or the glenoid fossa. So that's why it's called the glenohumeral joint. Again, you don't have to know that for this exam, but you will have to know it for the next. So I'm just previewing it. So there you can see the glenohumeral joint. Look at the illustration. The glenohumeral joint. That's your shoulder joint. That's the fancy name for it. And that's the name we're going to have to use. So the clavicle is an S-shaped bone with two curves. All right. See, there's a curve on one end and a curve on the other. Extends from the sternum to the scapula above the first rib. It has the sternal and the acromial extremities. So the sternal extremity is big and thick and club-like. The acromial extremity is thin and flat. So it's the acromial extremity that attaches to the acromial process on the scapula, and the sternal extremity attaches to the sternum, your breastbone. This is one of the most commonly fractured bones in the human body. If you ever find yourself falling out of control and you know you're going to hit the ground, you can pretty much choose which bone you want to break. You can either stick your arm out to break your fall, in which case you'll probably break your wrist, maybe your arm, or you can tuck your arm and just fall right under your shoulder, and then you'll break your clavicle. So the most common place that fracture is where the two curves come together. In other words, right in the middle of the bone. That's a typical broken clavicle. And ligaments hold the clavicle in place to stabilize its position. So remember, ligaments, these connective tissue. We haven't talked about exactly what a ligament is, but we will get to that. But ligaments hold a lot of bones in place. Just get used to that idea. Ligaments hold bones in place, as they do with the clavicle. So a shoulder separation. We're going to make a difference between a shoulder dislocation and a shoulder separation. So a shoulder separation is a sprain of the acromioclavicular ligament. So think about it. What would that mean? Acromioclavicular ligament. That's where the acromion process of the scapula comes together with the clavicle. And there's a ligament. So you can see there a type 1 shoulder separation is where there's just a little bit of a tear. Type 2, there's a bigger tear. And type 3, the whole thing is torn apart. That would be a severe separation of the shoulder. So the scapula, let's take a look here, articulates with the clavicle and the humerus. The subscapular fossa is filled with muscle. So this is the anterior side. See how it says anterior view? This is the front side of your scapula. It's concave, it's caved in. And there's a big giant muscle that sits there, as we'll see coming up. So it's the subscapular fossa. It's the big depression on the entire front side of the scapula. The coracoid process is for muscle attachment. Remember, most processes are either for joints or for muscle attachment. In this case, that doesn't make a joint. That's just where muscles attach. Muscles like your biceps brachii, which people normally just call biceps. We won't be able to get away with that anymore because there's a biceps on your arm and a biceps on your leg. There's biceps brachii, the one on the arm, and biceps femoris, the one on the leg. Biceps, by the way, means two heads. As we'll see, the muscle has two heads. That's why it's called biceps. And then there's another muscle called, well, we'll see it coming up, all right, coracobrachialis. Where do you suppose coracobrachialis attaches? Yeah, it attaches to the coracoid process and to the humerus, the bone that's in your brachial region. Looking now at the posterior side of the scapula, it's a triangular bone, all right, found in the upper back region. The scapular spine extends across and ends with the acromion process. The acromion process is why this is called the acromial region. And that forms the joint with the clavicle. That is the acromioclavicular joint. The glenoid cavity forms the shoulder joint with the head of the humerus. So notice how the glenoid cavity, sometimes it's called the glenoid fossa, is a depression and the head of the humerus fits in there. That's your shoulder joint. And then we see the scapular spine. So there is a depression above the spine and a depression below the spine. So we have the supraspinous fossa and the infraspinous fossa. And there are muscles that sit in there. What do you suppose the muscle that sits in the supraspinous fossa is called? Yeah, supraspinatus. What muscle's in the infraspinous fossa? Infraspinatus. See, they're named. It's so easy. Okay, so that takes care of the shoulder girdle. We're going to come back next and do the upper extremities.